Hello, Namaste, Jai Shri Mataji. I am Dr Anoop. After a very long time, I am doing a video. Today, I wish to present about my recent experience which I had and share this experience with all of you. I am sharing this experience not that everybody has to follow this or this is the fixed treatment or say like this is something like the final absolute or this is the ultimate or this is the only thing which you all have to do. That's not what I'm trying to convey, but my only request is to spread this message to all of you so that you all can try even this method also if it works out when each one of my Sahaj brothers and sisters are facing these issues. This is only my message to convey or the experience which I have to share. And experience which we share through Sage Yoga is not necessary that what the other people will be experiencing the same. No. It's one's own experience which one sees when he or she walks through his or her own journey. Same way, whatever experience you people all have, you also have to share. And I believe each and every one of us have a unique experience. So, Jai Shri Mataji. Now I'm going to share an incident which happened a few weeks back. I was actually having a very bad cough, and this cough initially started with running nose, sneezing. So that time I took it very light. Then later it started irritating my throat. Still, I did not take it that much because I am a workaholic human being, spending a lot of time in work. Then I meditate, and after that, I eat and I sleep. This is my life, how I run in a regular day basis. No exercise, nothing. Sometimes I may go out for walk, and I am most of the time working in the house itself, doing work from home as per my job requirement. So I neglected all this because I thought when I am meditating, all this will go. But gradually, the cough was increasing, and it was an allergic type cough because the room where I'm staying is filled with dust, paint, and there is no ventilation. Last year also I had this cough, but this was not that severe. It just went off by itself after a month. But this time the cough persisted in such a way that I was not able to tolerate the cough. It went gradually into cough because initially I did not take any medicines in the initial stage when I had throat infection, and when it went into a cough, slowly I started getting something like say sounds in the chest while breathing difficulties. When I'm sleeping, the cough comes in a projectile way. Like you may suspect it's some very infectious type disease or something. Then later what happened was this affected my work, and I thought of taking some break because I just can't eat my food, sleep at all because of this cough. When I start sleeping, it immediately starts like a bunch of multiple times projectile coughing. Then I went to the hospital and I tried to seek an internal physician, and he prescribed me some antibiotics, and he told this is not a pneumonia, and this is just like some allergic bronchitis or a dry cough, and he requested me to take 1 week antibiotics with cough syrup. And since I'm too obese, I'm around 112 kilogram, he told me you can also try a medicine for gas because this seems to be allergic, and also you have, if you have gas issues, you can take this gas tablet. But what I did was, after getting all those prescriptions, medicines, everything, I actually went to the hospital basically to get the prescriptions and the medications and the leave so that I can take good rest. In a way, it's not right, because when you go to hospitals, and me being an MBBS doctor doing this, taking all the medicines from the treating doctor, including the prescription, and not taking the medications and taking rest, means it does not sound ethical from a doctor's point of view, but from my life, it's my life, and from my health point of view, my perspective, my, in the sense, being a Sahaja Yogi, and I am a person who never take any medicines. So this was a challenging situation for me, because I hail from a doctor's family, and my mother also knew that I just went to the hospital only to get the medications. And how I ended in the stage of going to a doctor and getting these medicines, how I ended in the stage of getting these medicines, was because doctor checked my x-ray and my, he did a blood test, and he found out that the x-ray was having something like haziness in the right lower lobe. So if you ask me, it would be something like, I will just try to show you what exactly it is. If the photo is here, means I can show it clearly. Just give me a moment. Just a second. I just want you all to see the chest x-ray which I had. I can't see the film, I'm sorry. Maybe, and I just can't see. Okay, I'll just explain what exactly it is. The x-ray was like the right side of the lung, the right base was hazy, like you cannot see the angle being sharp compared to the left side of the lung, where the angle was very, very, very crystal clear and dark and sharp. So doctor thought the right side of the lung is having a little bit of pleurisy in the right base, but still he thought it's not a proper pneumonia, because pneumonia means there will be consolidation. At the same time, it cannot be called as a consolidation also, it's a query. But when he checked my blood, my CRP was very high, like say around 64, and he said this is definitely, you have to take medicines, and infection will be there, and so you have to reduce the CRP and you have to take antibiotics. And he prescribed these gas medicine, cough syrup, etc., etc., which I mentioned before. And also my hemoglobin was very low. So seeing the picture, my mother got frightened and she requested me to take these medicines. But I apologize to say that I did not take any of those medicines, and I went for a very big experimental challenge, because doctor told me to come after 2 days after taking these medicines to check the CRP once again. And I just meditated in front of Sri Mataji's photograph, and I was taking this lemon mixed with hot water and honey early morning, empty stomach. Whenever I wake up, empty stomach, because I'm not able to sleep because of this cough. I was not able to sleep, so I used to get up, and whenever I get sleepy, whenever I wake up, I drink this, mixing with honey, hot water, and lemon. And then only I started eating my normal food. I used to eat everything normally, rice, whatsoever I eat regular basis, nothing like dieting or something of that sort. Then I used to mix honey with ginger in a spoon and try to take it in empty stomach. Other than this, I did not take. This was a medicine, to be honest. And beyond that, I used to meditate and make myself feel comfortable. But still, I used to have very bad cough. But after 2 days, as usual, meditation and all these natural methods, when I went to the hospital, I did the blood test. I told the doctor lies that I have been taking medications. But when I checked my labs, the CRP level had reduced drastically to 19, which was 64. So I was like shocked. What? How can this happen? Without taking medicines, the CRP is reducing. At the same time, I convinced the doctor saying that, Doctor, I have bought your medicines and I have taken the medicines just to satisfy him. Otherwise, it will be like he will be very much upset why you did not take medicines. After all, I am also an MBBS doctor and he's a specialist. So it's not right to say that I did not take any medicine and challenge in front of a doctor, which is very wrong. So I tried to figure this out. So then I realized that CRP can drastically reduce if there is a reduction in inflammation, because whenever there is inflammation and infection, the CRP will increase. So what I believe is I hardly took lemon and honey. Maybe the CRP might have fluctuated. It keeps increasing and reducing. That after 2 days, the half life of CRP depends on that, and after 48 hours, it can reduce. This is what is my assumption. So, without taking medicines, also you can reduce the CRP, except that in this setup, taking an experimental challenge where no one is there to help around, I did not have anyone to help around, is a high risk. But if you are in a research center or with a team of physicians, or at least who are specialized in healing, it's not about being a doctor or a nurse or anyone. Whoever knows this work properly, and if they can help you out, means you can go for this risk. But otherwise, it's always advisable to take medicines. So after 2 days, when I checked the CRP, which came drastically to 19, but the cough was still persisting. So the doctor told me the infection has reduced, but the cough is still there. So I asked him only one question. If I take just 2 days antibiotics, can my CRP reduce this much? Or is it that if I wouldn't have taken these medicines, will my CRP really reduce after 2 days? He was confused. He couldn't answer this question. So he said it depends. We don't know about this. And it's all an assumption. We don't know. Maybe if you take antibiotics, CRP would have not even reduced, or maybe if you take antibiotics, CRP would have drastically reduced. This all we don't know. It's a myth. I still believe that this is a myth. But if there is an infection, antibiotics can act much faster compared to all these natural methods. And we all are taught and we all are doing this based on this studies which during our medical colleges, not just medical colleges, normal day to day life. Before I was being a doctor itself, from the age of small age itself, I was being introduced to antibiotics. So this is like a ritual. Whenever you have fever or anything, you take a Panadol, and infection means antibiotic. We don't think why we are taking this, what are the consequences, what if we don't take. All those time we never think. But after coming to Sahaj Yoga, I was doing research, in fact, in this past 1 month time within myself, and I thought of doing this video for all of you. So doctor told me that day, anyways, you finish the antibiotic course since you have started, as I convinced him that I am taking medicines, even though I was not taking any medicines. So he told you can finish the antibiotic course, and if you still have cough, he prescribed some other macrolides and other antihistamines. He said since you are fat, you don't need steroid treatment. If I give steroid, then you may have to go for CT chest, then all these etc diagnostic tests. This is all you'll have to do. I said I'm not willing to do because my cough, I feel, has not gone to that extent, but still my sputum was containing blood stain and green color things and all these aspects. But still, I thought, let this go in this pattern. Since my CRP reduced, my confidence increased. I believe that the cough also will gradually reduce. So, what happened? Daily, I used to try the same method meditation. I used to clear my Vishuddhi. Then I used to eat whatever I like, but I used to eat more of grilled foods and I used to include salads, leaves, legumes, proteins. And since I am more of a non veg, I used to eat more of chicken or mutton because my hemoglobin was also less. Then still I was not able to sleep because of this cough. In spite of reduction in CRP, everything, still the cough persisted in such a way that I couldn't sleep. So in the middle of the sleep, all I used to wake up, adjust, do all these methods inside yoga, fire and everything, but still the cough started improving. Like that, after 2 weeks exactly, my entire cough reduced, and now I'm not having any cough or any issues. And in this duration, in this time span, I was eating all what I liked, but in moderation. What I did more was focusing on the diet as well as sleeping well as much as I can. Because I realized that along with meditation, good food, healthy food, and sleep, anything can be cured much easily. Because even if you do Sage Yoga also, and if you are doing chakra clearance also, it's not necessary cough will go much quick. Because I did not even have the medications which I used to take before while practicing Sage Yoga, the edible camphor, Ajwain Dhuni, all this I did not do. My only treatment was having hot water mixed with lemon and honey, and after that, whenever I have dinner, I used to include salads. I used to eat rice, whatsoever, which I used to get with that. Then I took break from my work, and I was sleeping as much as I can because almost past 1 year I was not getting proper sleep. So why I'm sharing this video now, you all might be thinking, what is the point and purpose? Is it that should we not take any medicines and do as what you're doing? The answer for this, I cannot say yes, neither yes, no. But I have a report to the society as well as to the Sahaj committee also, the community also, because I have been practicing Sahaj Yoga meditation since years, and I'm truly a believer of Sri Mataji as well as the vibrations, and beyond all that, this technique, this massive technique of healing without any tablets, I have been trying since many years, and I believe that I still have a lot to go, but I am mastering after every experience like this. So this is the only way I can prove it to all of you. So if you feel, if you have cough, if it's not that severe, means you can try these methods which I have told, taking bed rest and eating healthy foods, and try to stick on to natural remedies like ginger or honey. You can do gargle. You can also do food soak if you're say like hot water or cold water, whatsoever you feel you can, and take proper rest, and never try to do too much of physical exercises or activity, and don't push yourself into jobs. You can take breaks. It depends on you. If you of course, obviously, if you have to go for a job, you have to take medicines and you have to go fast, because the myth is if you take medicines, temperature will be reduced, your all symptoms will be reduced, and you can do the work quickly. But the real truth is the underlying cause will not be cured. Maybe the symptoms might get cured, and still the symptoms will be persisting, and it will be very much frustrating to handle an entire day and move on with the day. So you have to know yourself. At the end, the underlying cause has to be cured. And for sleeping and taking rest, no one can do for us. If you want to exercise, still okay, you can use machines, or if you tie some band or something, or if you take a pill, that will do the work for you. But who will sleep for you? Who will take rest for you? Human beings have to himself take proper rest and sleep well, and find a solution for yourself. Because today the most biggest medicine, as per the medical statistics, for any kind of stress related issue, the first thing is a proper sleep. It's not about how many hours you sleep, how comfortably you sleep, such a way that even if you wake up, you should not be tired. Even if you sleep late night, even if you sleep any time, you have to sleep properly and comfortably. How whichever hours, it's not an issue. What you eat is not an issue. It's about when you feel to sleep, you should sleep. When you are hungry, you eat. So if you go in this pattern, you can cure any kind of health conditions. And along with that, if you do Sahaj meditation also, this will work out. You can clear your Vishuddhi using fire. But for me, when I used fire, it was not at all working out. So I cannot completely say use fire for any Vishuddhi related issues or cough. It depends from people to people. You have to find out which chakra is catching. Maybe you may have to use ice, because too much cough can also be right sided issue. So you may have to do ice treatment. So find out yourself, and whenever such conditions come, surrender. Use Sri Mataji's photo. Sri Mataji's photograph only helped me all this time. And so now, without taking any medicine, I cured this bronchitis and cough. Many people are afraid to even speak about this because they don't know, and some people, even if they know, they might be reluctant or shy to talk out. So I'm taking this effort to speak this out, because again, I'm telling, my message is not to spread that no one should take medicines and cure, like how I did this in this 1 month time. If you are that severe, if you have very high fever, temperature, you have to go get consultation, get auscultated by the doctor, do the necessary checkups, labs, and you have to start the medication. But don't blindly depend on medication. If you just take the medication, and if you eat whatever you like, and if you sleep midnight, or if you take alcohol, if you take smoke, what is the point of taking the medications? So you have to be very wise, and you have to see to yourself and experience yourself what you are and what you feel, and based on that you have to come to an analysis. If a doctor writes the medicines, no need to take the full course, and if he tells to take further, if you feel comfortable, then what's the need for the medicines? You don't need to even take the medicines further, correct? So it's all one's own viewpoint and experiencing what he or she is feeling, and based on that taking the proper uh, remedies at that proper time. That's how cure can happen. Healing will work out for all, but the ultimate cure, you have to have proper rest. And for that, parasympathetic system has to be activated through meditation. Even if you do too much clearance also, I'm not saying the cough may go, it may even increase also more. It will cause more, like say, it may not even improve. So try to take a break, try to take complete body rest. The only way for proper total body rest is only by sleep. Plus you add meditation and healthy food and all these, staying away from dusty atmosphere, and sleeping in a proper ventilated room, so you can cure like how I cured this fully. Thank you all for watching this video. Jai Shri Mataji. Try to take all the positives from this video, and I once again say, don't copy like what I did, not taking any medicines and sitting thinking that everything will be all right. Maybe for some people, even if they try this method, they might be frightened at one point of time, and they may think that, oh no, I have to take medicines or else this cough won't go. Too much of chest ache, too much of struggling. Why should I struggle? Why not go for a medicine? But the answer for this, you have to find out and tell me whether if you take medicine or if you don't take medicine, if this cough gets, if you recover from this cough, ask yourself, did the medicines work out, or did without medicines this work out, or Without medicines, without tablets, if the natural remedies work out, or after doing all this, taking natural remedies, medicines, everything you did, beyond all this, is it that just your immune system did that miracle? Out of all these four options, find out yourself and do more videos on this and share your own experience. Jai Shri Mataji. Thank you all.